Good morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
A couple of weeks ago, I met a hospice care nurse, and I was curious. I asked her, does it ever get you down? Does it bring you down because you're with people at the end of their lives? And her answer surprised me. She said, no, my job is to make people enjoy their lives. And I am an upbeat, happy person, and I try to bring that to the people I'm taking care of. Kathleen Kennedy is with us right now. She's not the one who told me that, but I think you would agree that that's the positive attitude is what you need in a hospice nurse.
Absolutely. One thing that is wonderful about working for hospice is that you get to be with people who are thinking about and talking about the most important things in life, not trivial things, because they know that time is limited. So families say the most important things to each other, and they concentrate on the most important things. They tell each other they love each other, and it's wonderful to be a part of that.
So you're a spiritual counselor,
yes,
as well as a volunteer coordinator for hospice.
Yes.
You must love it so much you said, no, don't pay me. I don't want any money.
No, I'm not a volunteer, but I train the volunteers and supervise the volunteers who work with the patients.
And I know there's a lot of training that goes involved, but I think a lot of people are born this way to take care of people.
I think that's true. I think the people that volunteer to work with us at Morgantown Hospice are by nature compassionate, generous people. So the training is to help them cultivate the skills that will help them do that, but they have the hearts for it.
I think it's a little calming when you hear, that somebody is not well and perhaps they're in their last stages of cancer or life, and you hear that they're going to call in hospice. Mm-hmm. You know that it's probably near the end, but you also know, well, that's good. That means they're going to get good care.
Yes, it does. And it also, one thing that people don't always think about is that knowing that your time is limited can help you make the most of it and really concentrate on time with family and important things to do. So it's really kind of a golden time. So we really foster that with the patients and families. We encourage them to take full advantage of the time that they have. I mean, we all know that our time is limited, right? We all know that life will come to an end. So we should live that way every day, but we don't.
But we like to be home.
Yes.
That's where our family is, our friends are, where we're most comfortable. So what can a hospice nurse bring to the home and to the person?
Well, the bottom line first is that we want patients to be comfortable. So the base is we want to be sure they're not in pain, they're not experiencing unpleasant symptoms, that they have all the medication that they need to be comfortable, that they have all the equipment they need to be comfortable, hospital beds, oxygen, wheelchairs, whatever, and then bring in the services that will help the family keep them comfortable at home. So nurses, aides who do personal care, social workers, volunteers, spiritual counseling, whatever they need to make the most of that time.
It almost sounds like you're there more for the family and the loved ones than you are for the patient.
Both, actually, but the family, absolutely, and we're also there for the family after the person dies. So
why can't families just do it on their own?
They can, but most people don't know a lot about what they need to do when someone is seriously ill unless they've experienced that. So we help teach them how to keep that person comfortable. And also it's exhausting, just taking care of someone who's ill day and night without any help. People get worn out, and we don't want that. And when someone is sleep deprived and when they're exhausted from the physical care, it's harder to be present emotionally with that person that they love. So we try to be around in the background and backstage,
Your support.
We're support so that they can do the important thing, which is being with each other.
Kathleen, you mentioned earlier about the family and what we would hope, and I'm sure you would, don't wait until you're on the deathbed to say I love you. Now's the time to live your life and to embrace those around you. And so many times, and I've seen it happen, they go through their life until those last few seconds, and then they want to express themselves. Boy, if we could just live our life every day.
Oh, absolutely. That would be the secret.
That would be the secret, absolutely. And you talked about volunteering, and you coordinate the volunteers, and you said training. What type of training do you need to be a volunteer?
It's a 16-hour program which helps prepare them for anything that could come up, and we practice a lot of things. We practice a lot of listening skills, things like that. We do it at whatever time works out for the most people. So anytime I have 5 or 6 people who can all meet at the same time, that's how we schedule the training. So
because this is a 24/7 thing for you to have someone there. Is that correct?
Well, actually, the families have to be there most of the time because the families want to take care of the patients. So we don't have staff or volunteers all the time, but they come in and fill in for a few hours at a time, and they're a support. So the training usually takes about 8 weeks, but we can do it on Saturdays. We can do it during the day. We do it at night. Whatever works out.
No special skills needed.
No. Compassion.
Compassion.
Generous spirit. That's all. They don't need any other skills.
Let me say that I've been in a room when this happened with my sister-in-law, and she was at Mon General. And when that time came that they knew there could be no other care given other than embracing that person and being there for them, Mon General, and I'm not just saying this because it's Mon General and you're here, I saw them embrace that family. Oh. They brought them hot coffee and asked them, what can we bring you? And it was almost like they had to give them some love for they can get through this horrible time.
We hear that all the time from
and
families.
I saw it. So very impressed with that. You mentioned spiritual counselor.
Yes.
Wonder if the individual hasn't had that in their life, all their life, to be spiritual. Do you find that they seek that towards the end, or do you bring it to them in another way?
Well, the way we look at spirituality in hospice is that everyone has a spiritual life, an inner life. For many people, their faith tradition is a huge part of that. So for those people, we make sure that they're connected with their clergy, if they want that, or with their faith community. But everybody has an inner life. So other people, their inner life has to do with their family or feeling proud of the life they've lived, the work they've done. And so we try to help them tap into their sources of strength, which is different for everybody because everyone has a way that they've gotten through difficult times in the past.
Where they cope with it.
Exactly. So we figure out what that is, and we help them use that and tap into that and set goals that are reasonable for the time that they have.
Who brings hospice in? The hospital, the patient? Or?
It can be any of those. Sometimes the doctor will say, I think it's a good idea to be exploring the possibility of hospice. Sometimes the social worker or the nurses at the hospital. People sometimes call us. The patient themselves will call us. It can come from all different directions.
If you could use some free spiritual counseling this morning.
Yes, anytime.
You could call right now, 304-296-0041. And Kathleen Kennedy is our guest, and she is a spiritual counselor and volunteer coordinator for hospice. And this is Health Talk, brought to you by Mon General on WHAR.
This is Mon General's Health Talk, providing the information you need to take charge of your health. Call us now with your health-related questions at 304-296-0041.
Kathleen Kennedy is a spiritual counselor and volunteer coordinator for hospice. So we're all individuals, we're all different, but when it comes to the end of our lives, I'm going to say to you, I didn't go to church all the time. I'm not sure I'm right with God. I do want to go into heaven. Is it too late for me?
Absolutely not. I have no straight line to God. I can't answer that question, but I know what it's not too late for. It's not too late to talk about your life. It's not too late to examine what principles you have always thought you wanted to live your life by and express any regrets you might have, but also to feel good about the good things you have done, whether it's, raise a good family, a loving family, or work hard at your job. And so part of what we do is help people think through their lives and examine what they've done. And a lot of times they realize how much they have accomplished and the good things that they have done, and that they can feel good about that. They can say they're sorry to people that they may have hurt, whatever they need to do to feel ready for the end of
I
their
should have been
life.
kinder to Kay Murray.
Always.
But at least I made her laugh.
That helps.
All right.
Yeah, you should have been kinder. Always kind, Jim. We know that. You're this
Of
big old
course,
teddy
yeah.
bear. What is the Stephen Ministry program, is it?
Yes, it is. It's a wonderful program that we started about 5 years ago.
Okay.
And it's very unusual. There are only a couple of places in the country that do this. These, in addition to our regular volunteers who work with the hospice patients, these are volunteers who have special additional training in spiritual support. And they work not only with our hospice patients, but at the hospital, at Mon General, with the pastoral care department. So the chaplain at Mon General, Ed Horvat, and I train and supervise them. And they are available within the hospital, not for people necessarily who are dying, but anyone who would like a visit. Maybe they're having surgery the next day and they'd just like a prayer, or they'd like to talk about how they feel, or they're scared, or maybe they've gotten a difficult diagnosis and they'd like to talk about their feelings. The Stephen Ministry volunteer can come into the room and pull up a chair, and they're there, and they can listen, and they can help them reflect on what's going on.
Some people just have that gift. I mean, I really do believe that. Even though they want to be that way, I think it's there for you. If people that can calm other, like you're bringing a calmness into the studio this morning. You just have that gift, and I believe it's within.
It is. It
really
is.
is.
And one thing, actually, the biggest hurdle in training the Stephen Ministry volunteers is to help them feel that they have that within them, that they don't need special training, that if they're warm and compassionate, loving people, it's going to come out and it's going to help that patient.
You see that? You see me as a volunteer when I retire, Stallings? This would be...
No.
How about right now?
No, I don't. I'm not sure you make anybody calm.
Oh, now do you believe that?
I'm not like Kathleen. I'm just soaking it all in, man. It just sounds so good. You are perfect at what you do.
I'm going to
the
be really honest.
volunteers are
I don't want to
perfect.
see her for a long, long time. So that's what happens with what you have to do, I'm sure.
Yeah, unfortunately, I've always said I'd like to go like my mom did. Boom, that's it.
Yeah.
Well, most of us say that, but in some ways, I have to say that there is something to having some notice and some advanced
Some
time.
closure, so
that
to
you
speak.
have time to say the most important things to people and to do things that are
But what's
important.
interesting about that, Kathleen, is that Jim's mom did. And that's what's so special about what happened, is that they'd all spent some time together and expressed their love to each
that's
other.
But she
Wonderful.
wasn't sick.
Right. she
So
was
it's what
not
Kay
sick.
talked about earlier in the program. Say, I love you now.
Oh,
Yes.
yes.
While you're healthy and well. Because you may
Absolutely.
not have the chance, but luckily she did have the chance.
That's wonderful.
Live that life.
That's a great gift.
All right, we're going to take a break. And again, we are offering free spiritual counseling on the program today.
Not by Jim Stallings.
No, no.
And not by Kay Murray.
Matter of fact, if you want me to leave the room, I will.
It might be best.
Kathleen Kennedy is our guest. You're listening to Health Talk on WAJR.
This is Mon General's Health Talk. If you have a health-related question, call us now at 304-296-0041.
We're talking about hospice care today and some of the spirituality that goes with it that most of us seek towards the end of our lives. Kathleen Kennedy is our guest. I'm Jim Stallings along with Kay Murray.
Yeah, we were just talking when we came back on the air about where do you go to do this? Do you go to Mon General? Can people be in their homes and you come into their homes? Talk about that, traveling.
Morgantown Hospice works where the people are. So most people would like to be at home rather than in the hospital. So that's where they are. They stay at home when we bring the services to them. And then there are some people who, for whatever reason, cannot be at home, and they're in nursing facilities and long-term care facilities. So we also go to them there, and we provide services there. We work with patients in all of the nursing homes and assisted living facilities in the county, too. So it's not, the Stephen Ministry program is different in that those volunteers work both in the patient's homes and in nursing homes and in the hospital. But hospice services that Morgantown Hospice provides are where the patient lives.
Okay, so hospice is actually located on Maple Drive.
Our office
Talking
is
about
located
that.
there, yes.
Where do you do the training, the volunteers?
We usually do the training at Monongalia Hospital in their conference center.
You know, we're talking about this morning, and people are at home thinking, you know, I could do this. I would really like to get them, but you're not quite sure. Could they just come and talk to you about it?
Absolutely, absolutely. They can give us a call, 285-2777, and we can talk about it. If people think they might possibly want to volunteer, but they're not sure, we can sit and talk about it. And also, if people think that possibly a family member is getting close to where they might want to consider hospice, it's always better to investigate earlier rather than later. So they can give us a call. We'll talk about it over the phone. We'll come and visit them and talk about it. There's no commitment that needs to be made. They can just get more information.
Is there a cost involved in having
Absolutely
hospice
not.
come in?
Absolutely not. The work that we do is reimbursed by Medicare and Medicaid and almost all private insurances. But if someone has none of those, we just provide it for free. We don't charge anyone for any of the
How many
work that we
volunteers do you have at this point in time?
We have about 35.
How many would you like to have?
Oh,
What's your
it's
dream number?
Unlimited. We can use
Sure.
them all.
I'm sure.
Yeah.
Is there some travel involved in this when you talk about going into homes in and around the county?
Only this county. We don't work, we're totally a local community-based hospice, so we only work in Mon County. So the furthest reaches of Mon County, we do have patients, but if volunteers, we fit the task to the volunteer's life. So if someone would prefer to stay right within Morgantown, that's fine. We'll only give them patients, in Morgantown.
I would think that the number of people that seek hospice care is going to go up. I mean, because those baby boomers are getting up there. We're already past retirement age for the upper level, the upper years of that, and I would imagine that is going to be a lot more need in the future, don't you think?
Absolutely, absolutely. You're absolutely right. That as the population of the country ages, we are living. More people are living to a point where they are elderly, and there are many things that can happen as you get into your 70s and 80s, and there'll be a lot more people that do need the care. So we're here, and the service is available.
And a whole different genre, so to speak, than the in-home health care that people get. For instance, if somebody has Alzheimer's or debilitating disease like that, you are called in when there is a certain amount of time left?
The ideal or the goal is when someone is in the last 6 months of their life. So if a physician feels that probably this person is in the last 6 months of their life, that's what hospice is best designed for. But we have people sometimes for less than 24 hours, and it's unfortunate that we didn't have more time, but we can help in 24 hours. But we have other patients that we've had for much longer. We don't. It's not always clear how much time someone has. So whatever time they have, that's what we work with.
And I still believe that hospice nurses and volunteers are angels, because I think about every person they work with more than likely passes away
Yes.
when they're there, or they've become involved with the family and get to know the family.
Absolutely.
I mean, how can you you can't disassociate yourself from caring about someone who's going to pass away.
No, you don't at all. I mean, we all care about our patients, and we cry with the families, but there's a different feeling, I think, because there's a different goal. Since we know at the beginning that everyone that we work with is going to die, our goal becomes making that time as good as it can possibly be. And so when that time is as good as it can possibly be, we feel good about what happened, and we feel good about the interactions that everyone had.
So there is a certain satisfaction you feel of a job well done.
Oh, absolutely.
And a lot of people would think, no, it's like somebody passed away, I guess I didn't do my job. That's not it at all.
No, not at all. Not at all.
Well, thank you so much for
Thank you for having
information this morning and your calming tones. Do
You're
you take
welcome.
house calls or anything? Because I'd love to have you sometime if I need you to just come by.
That would be
Call
daily.
anytime.
Maybe
All right.
daily.
You've been listening to Health Talk, brought to you by Mon General on WAJR with Kathleen Kennedy. Stay tuned for Morgantown AM coming up next.